So for more on this, we want to bring in one of our COVID experts from UCSF Infectious Disease Specialist, Dr. Peter Chin Hong.
Doctor, thanks for joining us this morning. I want to go back to something that Sierra just said about this long-term effect that young children may be having. We can't vaccinate them. They may not get terribly ill. We know Omicron to be fairly mild, but these long-term effects might frighten parents very much.
Yes, definitely, Scott. I think that long-term syndrome, MISC, it's very, very rare, but definitely something that happens. We're not really sure if it's going to happen with such frequency with Omicron as with the previous variants. So that's some, reason to pause and hope. We definitely know that when the immune system gets very activated, that later on you can have some of these chronic symptoms that can affect the heart or other organs that happen a few weeks after the illness.
Doctor, it's really concerning. A lot of people feel like they're a little bit more free because they have their COVID vaccinations, they have their booster shots. They're not getting terribly sick if they do contract COVID. But we have to remember that these children can't be vaccinated. So we have to continue to be mindful of masking. Is there anything else that we can do?
Yes, definitely. The easiest thing that you can do to protect the children who can't get vaccinated, those under 5, is to build a wall of immunity around them. That means to vaccinate and boost as many of the adults, the adolescents, the kids over 5 in that child's life. And the more you do that, it's harder for the virus to penetrate through that wall. And of course, looking out for symptoms, doing testing when people particularly are symptomatic, but not really worrying too much. Only about 1 to 2% of kids get hospitalized. Even though it sounds like a big number, it's still a small chance that a kid will get hospitalized, and even fewer will die.
Well, the concerning thing is you don't know which kid it's going to be. So even if it's few, you just don't know
As a parent, absolutely. So on Wednesday,
yes.
The federal government on Wednesday, this website will go live. People can order 4 free tests per household. What impact do you think that'll have on the spread of COVID? Obviously, we're gonna see potentially more cases as we have more tests. But what do you think that'll help contain the spread?
Well, I think to a certain point it will, for sure, Scott, because that is if the person who's positive stays away from the rest of society who's negative. I mean, it does. Right now, with so many being positive, you have to assume that anyone that you encounter is potentially positive in public, and that's why it comes down to being protected in risky settings. That is indoors, particularly if you're staying for a long time, wearing a higher grade mask. I like a KN95, it's more comfortable than an N95, but something like that if you're staying there for a long time. Otherwise, your basic mask is the minimum a surgical mask that's well fitted, or you can double mask as well.
All right, so we've been hearing about boosters and how important they are to keeping our immune systems, strong enough to handle that COVID. What symptoms are you seeing in people who contract COVID but got that booster shot? We know that it's less severe, but how much less severe?
Yeah, so to tell you the truth, Kris, I'm not seeing a lot of people who have been boosted in the hospitals. It's still about 90% unvaccinated and otherwise immunocompromised for the 10% of people, and they, may definitely get a vaccine and not know or not have a response. So if people are getting boosted, actually the most important symptom is no symptoms, because their body is so mild, or taking the dealing with the virus so mildly that they may not be symptomatic. It's estimated that as much as 20% of people may not know that they have COVID. So that's why it's important to sort of keep your guard up when you're going out and about.
So the folks who are counting on herd immunity, who still have not been vaccinated, it is likely that they could end up in the hospital if they contracted at this point.
Oh, yeah, definitely. I mean, I think one of the myths of Omicron is that it's mild, but sure, it's not as deadly as previous variants, but people are still coming into the hospital because so many people are infected, and that's why you're seeing hospitalization rates increase, and hospitals are beginning to break at the seams. So I think, for all of us, we need to sort of hit that pause button as much as we can. I think for people who are unvaccinated, it's no guarantee for the future. I mean, look at Omicron. And again, I tell you that people are still coming into the hospital. having had Delta is no protection for Omicron. So having had Omicron doesn't mean that you're going to be protected in the future for some other variant.
All right. Dr. Peter Chin Hong, thank you so much for joining us this morning. We know it's bright and early.